Hello, so my name is Michelle Norton-Hughes. I'm a physiotherapist from Rebuild and Thrive Physiotherapy, and I'm holding a pelvis. And there's a reason I'm holding a pelvis. I am a physiotherapist that is passionate about everything that surrounds our pelvis and our lower back, all the way down to our knees. And the reason that is because so much is connected. Our pelvis is the basis of our core, and from there we have lots of attachments to different muscles. So I'm going to tell you a little story about one of my clients who came to see me with reoccurring hamstring tendinopathy. So that is when you might get pain right up in the crease of your buttock. So this is the front of the pelvis, this is the back of the pelvis. Your hamstring's attached to the bottom here, okay? And she was getting a reoccurring pain right on that attachment point of the hamstring pelvis. And she had seen various clinicians, and she was a really good, really competitive cyclist. But this was holding her back. And when I assessed her, I did a full body assessment, and I worked out that although her hamstrings was very painful, they were actually quite strong. And it wasn't a weakness, and it certainly wasn't a lack of range of movement. She had fantastic range of movement. But they were overworking, and why they were overworking was because, this is the back, remember, her glutes were completely underactive. So she stood, and she was a strong athlete, but her bottom was completely flat. So she had very little activation of her bottom muscles. And this was meaning that as she was working, her hamstrings had to do so much more work for her. And this lack of activation of her bottom and her pelvic floor and her core was meaning that her hamstring was overreacting. So the treatment that she had before was treating the symptom but not the source of the pain. So obviously when you're in acute pain, we're going to treat the symptoms as well, because we want to help you to feel less pain when you walk out. But I try to always peel back the layers of the onion and make sure I'm treating you as a whole, and I'm getting to the source as to why you are getting that problem, so that hopefully you make me redundant and I don't need to keep seeing you. If this is the case, if this is sounding familiar, tag yourself, tag a friend down below, and then talk to me about it. I'm happy to answer any questions. Alright, have a good day everyone, and remember, do your bottom squeezes.